Thank you. Kalimera says. Can you hear me well?
Yes.
Thanks. Um, I would like first to thank the organizers for giving me the opportunity. And sadly, I cannot travel today to Greece. And Greece is really close to my heart because, it's really my second country. My wife and my children are Greek, so I'm really missing the country. I'll be back very soon. Today, I want to present the work that we are doing within the lung cancer collaboration, and I will share a few slides if you allow me a second, and if you can see them, I hope so. So today, I wanted to really, in terms of showing that what we do at UICC, we are based in Geneva, and we are addressing cancer control as a whole, but we have a program which is called the Lung Cancer Collaboration, really to drive the commitment of coordination between the international and regional aspect of addressing lung cancer, and specifically lung cancer survival. Really briefly, and I think that it's an important slide to show here, is our membership is composed of organizations that are addressing a whole range of different aspects of the cancer control community: academic institutions, cancer centers, cancer patient support groups. We have 40% of our member organizations that are cancer patient groups, professional associations, and so on. So since, these are the latest numbers, but around 1,200 member organizations are members of the UICC within 170 countries. So we have an international reach, and we work together with our members, and HELOC is one of those members. And talking back to lung cancer and early detection of lung cancer, these are few numbers about lung cancer. Almost 2 million deaths from lung cancer out of 2.4 million cases annually. So it's really above all the other cancers. It was shown that early diagnosis really improved the survival rates from less than 10% at stage 4 to about 60% at stage 1. And it also reduces the healthcare cost by 2 to 4 times compared to really late stage, so stage 3 and 4 lung cancer. It was shown also that early detection and treatment of survival, we saw that, but we need concerted effort. And this is why I showed you about the coordination between the different members that we have at UICC, but also with the different stakeholders, the UN agencies, the WHO IARC, for instance, the WHO headquarters, and within each region. But without those coordinated efforts, the lung cancer deaths are predicted to increase by 2035 already. We recently issued a paper in the Lancet Oncology in January 25, looking at different aspects of the cancer control continuum. And I'm sure that you discussed that this morning. I saw the program, that in our study, we saw that only 12% of national cancer control plans have a strategy on lung cancer screening or early detection. If you compare that to other cancer types like cervical cancer or breast cancer, it's 89 or 90% for both of them. So you can see that there are discrepancies and gaps into addressing other types of cancer. And I'm just talking about lung cancer, but if you look at other cancer like oral cancer or colorectal cancer, these are similar numbers. So the World Health Organization recommends combining that public awareness, the work that we do, health services, and really equip the healthcare workers in countries with timely diagnostics, just to decrease the mortality and to support the lung cancer care pathway. So this is some background about the work that we do. What are the objectives of the program that we have at UICC, the Lung Cancer Collaboration? If you look at the yellow box, it's really to work, as I said, with different stakeholders with similar interests. Air pollution, because we know that air pollution is one of the aspects of lung cancer as a risk factor. Tobacco, obviously. but also NCD organization, other civil society organization, patient groups, as I said, and also private sector, public-private partnerships are key to really support our programs. We want to focus on the lung cancer care pathway. So this is the blue box, raising awareness on lung cancer, about the whole cancer, on the whole cancer control continuum, prevention, early detection, treatment, survivorship, and also accountability of the different policymakers and the governments and so on, and the patients. We conduct global and local advocacy. So we integrate our lung cancer advocacy briefs and in the lung health resolution. So a few weeks ago, we integrated all the lung cancer care pathway into a lung health resolution during the WHO Executive Board in Geneva. So that helps also to work with the country representatives, policymakers, and also experts on the ground. We support technical guidance development. So we work with WHO and WHO on cost-effectiveness studies about lung cancer screening, and also development of lung cancer screening handbook. We started a contribution agreement with WHO to develop that kind of technical guidance, and it will be released, we hope, in early 2027. And finally, and this is the work that we currently do during these events, it's really to encourage the information and sharing at the global and regional level, and connect with the different networks and our members in different countries. So, as I said, as an achievement, we have a contribution agreement with WHO to develop that technical resources, and we work with the different member states to have integration of lung cancer screening and lung cancer care pathway in policy documents. And today, I have one question, maybe for the panel and for the audience, is what actions need to be undertaken in your home country, in Greece, to make lung cancer control strategies developed and implemented. So thanks a lot, and ευχαριστώ πάρα πολύ. Thank you.